Thank you everybody for coming tonight. So tonight is going to be a really fun night. We are going to talk about how to refresh, revive, and rejuvenate for 2011. So it's the new year, and let's make everybody new. So what we're going to do is we are going to go through the ways to look younger. And Hef, boy, I'll tell you, he is the prime example of rejuvenation. This guy is 84, but what you don't know is she's 93, and she's 106. So rejuvenate, 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 and you can keep looking young and happy and healthy, just like Hef, forever. So that's really the whole point of this talk, is how do we do what these three are doing right here. Everybody knows who this is. Michelle Pfeiffer, she's a stunning actress. She's one of the most beautiful women really on the planet. The most stunning thing is that she's 52 in this picture. Look how nice and tight her neck is. Look at how nice and defined her jawline is. Look at her nice full lips and cheeks. And she does have some wrinkles, of course. She does have some folds around her mouth, just like all of us do. And you know what? She should. There is no such thing as a face that's free of folds and wrinkles. It's not natural. It doesn't look natural, and that's not what you should want. Michelle looks like a very refreshed version of 52. If you look at her closely, you can believe that she's 52. But if you look at her for a split second, like most of us interact with everybody on a daily basis, you may not guess that she's that old. So that's really the goal here. How do we look great for our age, but doing so naturally? And this is a really interesting composition of photographs that I put together for a blog article that I wrote about celebrity cosmetic surgery. And this is a great, great example of how our face changes when we get older. So look at Michelle back in 1976 when she was a teenager. Look at the shape of her face. Look how it's really a heart shape. Okay, she's got a lot of volume up in her cheeks and really a tapered chin. It kind of stays that way through the 90s there, but you notice it's a little bit different. It's not quite so pronounced. If we had a picture of Michelle when she was a baby, she would have a really fat little cherubim heart face. Okay, and that's kind of the extreme example of youth, the baby. So as she gets a little bit older here in 2001, you can see that her face takes on a more square shape. And why is that? That's because the volume that used to be up on those cheeks, the fat underneath the skin and connective tissue, starts to kind of descend down. As we age, that happens to every single one of us, and it happens all over the body. It's not just the face. Okay? Now, the key is that look at the difference in the first set of photos. There's a big difference there. She still looks very young in 95, but she looks very different from how old she was and how she looked in 1976. Look at the bottom row of pictures. In 10 years, she looks different, but not that different. And that's the key to this talk, is how do we keep ourselves looking as young as possible once we get to this stage of life. The vast majority of the change has already taken place physiologically. So how do we keep everything the same as it's been, as close to we can get? And if you look at her in 2001 and 2009, she looks very beautiful in both those pictures, and that's 8 years apart. So how do we do that? So here's what we're going to talk about tonight. Why do we do it? How do we do it? And what does it look like when we're done? Okay, that's how we're going to organize this talk. So why do we do it? Well, we just said everybody wants to look younger. But what does that actually mean? So we talk about the skin having texture, and it's got grooves, and it's got furrows and wrinkles and all those things. We talk about the size of your pores. There's a bunch of different things. And you can see here this woman, she's certainly got her furrows around her mouth. She's got defined little wrinkles here, really all over her face, especially on her upper lip. She's got a bunch of extra skin here on her eye. She's got some wrinkles on the side. You know, she's really got everything here on this list. But how do we treat all that? First of all, you have to decide what's causing the problem, okay? So wrinkles and grooves are all from different things. These grooves right here are from the tissue kind of falling down, as we talked about. All this stuff that's making this groove used to be up here. Now it's coming down. That's a different story from these little wrinkles on the side of her eyes, okay? The wrinkles on the side of her eyes, around her mouth, around her chin. If you notice, all those little wrinkles are in places that move a lot. The lips move and talk all the time. The eyes are constantly blinking all day long, thousands and thousands of times. The muscles that do those things are what make those wrinkles in the skin. They pull the skin together and they make them wrinkle over time. So two different problems here, and that's a really important point to understand. We rejuvenate to fix problems with color. You can see, redness and things like melasma and rosacea and little spider veins, and all those things cause color changes in our skin. Of course, we all want to have nice, smooth, skin that's a very uniform color. So that's another reason to rejuvenate. As we get older, we spend more time in the sun, whether that's a little or whether that's a lot, that changes our skin color. So that's another way to keep ourselves looking a little bit younger, and maybe going backwards a little bit. As we talked about at the beginning, volume is really the key to aging. And in my profession, there's been a big paradigm shift over the past decade or so. We used to want to take fat out of the face. And back, I would say maybe 15 years ago, one of the big procedures was to take out a fat pad in the cheek to get rid of some of this fullness here that comes when we age. That looked great immediately, but everybody stopped doing that very fast because they realized that 10 years later you look terrible. And why is that? Because we're losing volume in our faces anyway. So now the paradigm has shifted to putting the volume back where it used to be, and if it's gone and there's nothing to put back, we put artificial things in there to replace it. So Christopher Walken, boy, there's not much to say about that. I mean, his skin is just falling off. He doesn't have any volume in his face to hold that skin up. So it's literally falling off of his face. Look at these hollows here. Look at these hollows here. Look at the hollow up here in his temple. I mean, everywhere you look, it's just gone. Now, another example is Tilda Swinton. She's not a very old woman, but she looks a little bit mannish in this picture. And why is that? 'Cause she's got no volume. She's got these big hollows here in her cheeks. She's got these hollows here. She has nothing that screams, that cherubish little infant look that was very young. So it makes her look a lot older than she is. And we got two different drastic examples here. And I like to talk about the 3 F's of facial rejuvenation. You have fillers, which can be artificial. You have fat, which is taken from your own body. And you have a facelift, which is putting the stuff back where it used to be. And those are really the 3 components of restoring that nice, youthful look that we all want. So here's her after. She's very bruised. It still looks like she has those bags under her eyes, but that's not bags, that's bruising. Okay, but look how much happier and bright she looks. This is 3 days after surgery. Okay, so we got a great result, especially if we think about 2 weeks down the road when that bruising is all gone. She's going to look wonderful. But we didn't stop there. So we did a little bit of thermage, which is similar to the accent that we have here, to try to tighten up her brow a little bit. She still had a little bit of extra skin kind of hanging down, so we wanted to tighten that up a little bit. She had a little bit of a fold here, which bothered her, and a little bit of a fold here, which bothered her as well. So we decided to use some Radiesse and Restylane to try to correct that a little bit. And look at her now.
Wow.
What an amazing difference that is. And the one thing that I want to point out is look at her overall demeanor. Did you see that before picture when she came in? Look at her hair. She didn't choose to do anything with it that day, and that's just because that's how she felt, because that's how she felt when she looked in the mirror. And look at her there. She's got makeup on, her hair is a little bit highlighted, it's styled differently, and look at the look on her face. It's wonderful. Okay? And again, if we had just done the surgery, would have been good, not like that. If we had just done the fillers, would have been good, not like that. Okay? It's a very, very powerful thing to combine those 2 techniques into one recovery, one procedure, and you get your result right away instead of having to do 3 and 4 and 5 and 6 procedures. So thank you very, very much, everybody. I'm here every Thursday, and please come by and see me sometime. So if anybody has any questions about any of these slides or you want to go back to any of them, I'm more than happy to do that.